So today we are going to be discussing the Lone Star tick and their cousins.
Yes.
The alpha gal
The
syndrome.
alpha
You'll
gal.
explain that to us.
Yes.
Right.
Sounds pretty ominous.
Sounds
Yeah.
like something that's over in Martha's Vineyard.
Well, we will talk about it.
Okay.
Morning, Commissioners. Like I said, I'm Escher Cattle, and I'm an entomologist working at Cape Cod Cooperative Extension. I'm here with Lea Hamner in Public Health for a collaboration between our two offices. We want to convey some important information about Lone Star tick and alpha-gal syndrome to the Commissioners, but also to the residents of Barnstable County. For my side of the presentation, we'll talk about what happens before the bite, mainly information about the Lone Star tick itself. I'm going to assume a certain amount of familiarity with ticks coming in. Different species of ticks can spread different diseases, and out here on the Cape and Islands, they're a long-standing and year-round problem. I'm sure you know about deer ticks and dog ticks by now, but I'd like to talk to you today about a third species of tick that showed up a little more recently, which is the Lone Star tick. The Lone Star tick, or turkey tick, is a round, orange-brown tick named for the distinct white spot on the back of the adult female you can see in the middle here. While it's been found in Texas, its range pretty much spans the eastern side of the United States, from Florida to Maine and out west to Nebraska. Unlike other ticks that we know on the Cape, Lone Star tick is a more generalist blood feeder. It can feed on a very wide range of animals, from white-tailed deer to wild turkeys, to domestic animals like cows and dogs, down to smaller mammals like opossums and rabbits, and of course, people. As I said, Lone Star tick's range spans most of the eastern United States, but has expanded to the north in the last 15 or more years due to host and habitat availability. My predecessor, Larry Dapsis, first received and conformed reports of Lone Star tick in Barnstable County in 2012, finding already well-established populations at Sandy Neck Beach Park. Now in 2025, according to tick expert Dr. Stephen Rich from UMass Amherst, Lone Star tick can be found all along the Cape, all the way out to P-Town. This coming year, I'm hoping through sampling we can get a better picture of Lone Star tick population densities across Barnstable County. Lone Star ticks live for a couple of years in good conditions, but they're not out and active right now. They survive the winter by going into diapause, which slows down their metabolisms and allows them to go without feeding or moving around as much. However, as you can see here on this graphic the Martha's Vineyard Tick Program has put together, once the weather warms up, coincidentally as we start seeing tourists coming in, Lone Star ticks become active again and peak in the summer months. At this point, I'd like to talk a bit about Lone Star ticks' behavior. Compared to deer and dog ticks, Lone Star ticks are super ticks. They're strong, they're fast, and they're aggressive. Lone Star ticks are more robust and resistant to the kinds of conditions that kill other ticks. As opposed to being stuck in shady forest edges and tall grasses, Lone Star ticks can survive in drier and hotter conditions like maintained lawns and gardens. Larger stages of Lone Star tick can follow you around once they sense you. They're able to chase hosts up to 20 feet. And unlike our other endemic blood-feeding ticks, they can be dangerous to humans straight from the earliest larval stage. So I'm going to show you a quick video to illustrate what we call a tick bomb. And while it's playing, I also have, oh no, I forgot my laminated sheet. Martha's Vineyard Tick Project gave me a laminated sheet of a tick bomb to show you, but I sadly left it in my office. So this is hundreds of Lone Star tick in the larval stage, only about the size of a poppy seed, waiting on a blade of tall grass for something to brush by them. It's going to take a minute, but it's important that we watch the whole video so that you can get a good look. In the beginning, you could see all their little front legs. It was called questing behavior. They were waiting for something to grab onto, and you can see how they immediately dropped off that grass onto the metal clipboard and started spreading very quickly. That's hundreds of tiny ticks that could result in hundreds of bites that are more painful and itchy, and last longer than those by deer and dog ticks. Nasty, nasty picture.
Mm-hmm.
So I know I've given you a bunch of bad news just now, and you're probably a little worried or scared. But before I hand things over to Lea, I'd like to tell you some good news. The same personal protection strategies that you can use against bites from other ticks will also work to protect you from Lone Star ticks. You can still enjoy outdoor activities like gardening and hiking if you follow a few simple steps before you go and after you come in from spending time outdoors. You can dress tick smart with light-colored long clothing and tuck your clothes in so that it's difficult for ticks to get under them onto your skin. Leggings or joggers over socks also work for the more fashion conscious. You want kind of a tight elastic band over your ankle so that ticks can't get in. They're known to stop at that kind of restriction. You can wear skin-safe repellent like off or picaridin over any skin that's left exposed. But the best recommendation is to also treat your outdoor clothes and shoes with permethrin, a human-safe compound known to stop and kill ticks that come into contact with it. When you're ready to come in, you can take off any hitchhikers you see on your clothes with tape or a lint roller and put your clothes in the wash as soon as you get inside and let them dry on high heat. Taking a shower in the first 2 hours after you come in can also help you find and remove any ticks remaining on the crevices of your skin. You can check out our resources for more ticks on avoiding and preventing tick bites, but for now, I want to hand it over to Lea to talk about what comes after the bite.
Thank you very much, Escher, and thank you, commissioners, for giving us some time this morning to talk about both Lone Star tick and the human health risks that they pose. This picture in the slide is an illustration of what the Lone Star larval tick bomb looks like when they actually bite. A lot of folks don't actually see the ticks biting them. They are so incredibly small, and they're also a lighter color brown, so it's actually quite hard to see them. So this is why personal protection is so essential to prevent the bite before it even happens, prevent the ticks from getting to your skin before it even happens, because they are so small. These bites are very itchy. They last for weeks, and so if they cause nothing else, they're going to cause misery just by being itchy bites. Next slide, please.
That person looks like they're going to be very sick.
So alpha-gal syndrome is something that you might have seen in the news a lot lately. It's getting increasing coverage. Alpha-gal refers to a molecule. So it is not just a girl boss syndrome, I like to joke. It is actually referring to the molecule alpha or galactose alpha-1,3 galactose. If you could, Escher, click next. It's a carbohydrate molecule. And it is a molecule that's actually present in all mammals except for humans and old world primates like orangutans and chimpanzees. So it's in mammals that we eat, mammals that we pet, mammals that are in our medicine. And we'll talk about where these different exposures can come from. Next, please. And the syndrome part of this refers to the fact that it is an allergy, not an infection. There's no infectious disease process happening, which is why the babies, the larvae, can cause alpha-gal syndrome. And the syndrome itself has a wide range of symptoms that appear 2 to 8 hours later, which I will explain next. So the classic symptoms of alpha-gal syndromes, first of all, usually they show up 2 to 8 hours. The timing is very important with alpha-gal syndrome and actually very problematic with alpha-gal syndrome. So after eating and after drinking, 2 to 8 hours later, people are reacting. For some types of exposures like inhaling or injecting in medications, it can be faster, but usually it's a delayed response. And so symptoms can look like skin symptoms like hives, rashes, or itching. It can also look like swelling symptoms. Folks with alpha-gal syndrome sometimes have a unique kind of presentation where the palms of their hands and the soles of their feet get very red, itchy, and swell. Their lips, throat, or tongue can also swell, and their eyelids. Breathing and cardiac problems are, of course, more concerning. And so that can include cough, wheezing, shortness of breath, or difficulty breathing, and cardiac symptoms of a drop in blood pressure, dizziness, or faintness. I have a star on a group of symptoms, gastrointestinal symptoms, because some folks exclusively have gastrointestinal symptoms of abdominal pain, diarrhea, nausea, vomiting, heartburn, and indigestion. Some people, usually we eat our largest portion of meat or mammalian food at night, a steak, a hamburger, a pork chop, a bowl of ice cream. And so sometimes it really helps people identify what their symptoms are from with the PSA kind of terminology of the midnight allergy. We often call alpha-gal syndrome the midnight allergy because people will wake up in the middle of the night after dinner having these new symptoms and not understand why they're happening. The gastrointestinal symptoms can feel like food poisoning at first, but then it keeps happening in the middle of the night. And these reactions can vary person to person, but they can also vary within the same person. The reactions can change over time, involve multiple systems. Actually being consistently inconsistent is actually kind of a hallmark of alpha-gal syndrome, which is very frustrating for patients and providers alike. Next slide, please. So alpha-gal wouldn't be nearly as problematic if it was easily spotted. Obviously, a steak, you can tell. And really, that is the common denominator, is that to have alpha-gal syndrome, you must react to some form of mammalian meat. However, there's alpha-gal in so many more things than that. And so depending on how sensitive you are in your allergy, it can also involve dairy. It can also involve cross-contamination from a grill that cooks chicken that previously cooked a steak. For some folks, they cannot even be around a grill. They cannot inhale the cooking fumes of cooking meat. That causes them to react. These are less and less common as I go, by the way. Some people react to leather and even touching mammalian products or animals. There's untold numbers of mammalian products in beauty supplies. And what I argue is honestly incredibly problematic is reaction to medications. Some people can't take their gelatin capsules. Some people also don't even know what's in their medicines, because who reads medicine labeling for mammalian products? There are services like Pill Clarity that will help patients figure out if mammal products are in their medicines and find safer products, but this is a pretty troubling development. Next slide. So to recap alpha-gal syndrome, because it is really completely different than anything we've ever dealt with before. First, we have a tick bite. In the United States, it's from the Lone Star tick. Internationally, it's other ticks. Tick bite happens. We don't know how long the tick needs to be biting you to cause this syndrome. Weeks to months later, you're then consuming some sort of mammalian containing product, and then hours after that consumption, you react. And that's how alpha-gal syndrome works. Next slide, please. And who has alpha-gal syndrome? Turns out a lot of people have alpha-gal syndrome. It was only medically discovered and characterized in 2009, and it was only linked to tick bites in 2011. So in medical history, it's a fairly newly discovered condition, but since then, nearly 500,000 Americans are estimated to be living with alpha-gal syndrome, especially where more Lone Star ticks are found. So you can see the red on this map is in these South Atlantic states. That's where Lone Star territory has been traditionally, but it stretches as far up to us. Next slide, please. And I want to talk to you specifically about Martha's Vineyard. I also work for Martha's Vineyard, and alpha-gal syndrome has hit us like a sack of bricks. Lone Star tick has hit us like a sack of bricks. And so this is what testing has looked like on Martha's Vineyard. It went from relative obscurity in 2020 to a huge amount of tests run this year to date. Over 1,600 tests run. In gray bars, those are total tests performed. And then pink are the total number of positive tests. And that is an exponential increase. We do not want to see exponential increases in anything. And so an exponential curve is very bad news. Next slide, please. Now, with testing data, I do want to preface, because the Martha's Vineyard data is making the rounds. It was in the New York Times. It was in the Times of London. It's been on national news. However, something I want to just make very clear for both the commissioners and anyone listening on this presentation is that a positive test on its own with no symptoms does not equal allergy. There's no such thing as an asymptomatic allergy. You have to have some sort of symptoms. That is what the allergic response is. And so people who test positive, which I was showing you in that last chart, number of positive tests is one piece of the puzzle. And then we need to figure out, and this is the next level of investigation and project that needs to be pursued, is of those people, how many have allergic symptoms? Now, on Martha's Vineyard, we have actually a back of the napkin idea, because there was only one allergist on the whole island who actually recently retired in October, but he actively had 400 patients he was seeing for alpha-gal syndrome in a community that's only 20,000 people, which is a huge amount of people experiencing alpha-gal syndrome symptoms. Next slide, please. Now, This is also a really new thing. Again, in medicine, we've talked about this, and really healthcare provider education is the front lines of really making sure that we're meeting the needs of our community, because our physicians need to be aware. This data in front of you is from 2023, when the CDC did a survey and found that by and far the majority of providers had never even heard of alpha-gal syndrome. 78% of healthcare providers at that time, 2 years ago, knew little to nothing about alpha-gal syndrome, even though it is now the 10th most common food allergen. That I'm sure if we repeated this information in this survey again, that would be very different, because there's been so much coverage about alpha-gal syndrome in the press, as well as to healthcare providers, but there's still a lot more to do. And so I have the next slide for you about our plan of action. We do have a Barnstable County Tick-Borne Disease Advisory Group. I've been largely spearheading our meetings in the last 2 years. And healthcare provider education has been a big part of that kind of brainstorming and purview. So we're going to continue to pursue healthcare provider education and outreach, as well as community outreach and education on Lone Star ticks and alpha-gal syndrome. We have a shared library of resources already with editable handouts, presentations, and materials. And we do have a strong partnership, and we will continue to have a strong partnership with the Center of Excellence out of University of Massachusetts. And also planned for 2026 is a month-to-month, week-to-week communication calendar based on the seasonality of ticks, diseases, and allergies, so that we're communicating with our community before the bite, during the risk, and after the bite, so that we're helping people understand what they need to be on the lookout for and how to protect themselves. And so with that, we are going to end by saying that we do have a live website already. We have gotten great feedback on our website already. It was launched in spring this year, capecod.gov/tick prevention. Please check it out. We will continue to be adding to it, but so far people have found it very useful. And with that, I will conclude. Thank you.
Thank you. This is scary stuff. So there isn't any antibiotic or any treatment as of now.
Correct, because it's an allergy, it is not treated with antibiotics, and there is no allergy treatment that is known to be successful. Actually, thank you for asking that question, because for some people, the allergy can go away in usually the matter of years, like 2 to 3 to 5 years. Key to it going away and having a chance to have it go away is not getting more tick bites. That's really important.
Right. Now, correct me, if somebody gets a tick bite, a deer tick bite, and they go to the doctor, they're usually administered some sort of antibiotic for a month. And that seems to work. But there isn't such a thing to ward off any so really the biggest side effect of having a bite, not only is it itchy and that sort of thing, but it's this allergy that you get. That's whereas in deer ticks, people will associate aches, pains, different other symptoms. Does the Lone Star also give those in addition? Do we know?
Lone Star carries also other infectious diseases too, including bacterial infectious diseases and viral infectious diseases. And so there's the possibility that someone can get an infectious disease from a Lone Star tick bite as well. Alpha-gal syndrome, again, being an allergy and not an infectious disease, has a different set of symptoms. And so it won't look like what people are used to, the aches and pains of Lyme disease, perhaps. You won't have a fever. You won't have signs of infection because it's an allergy. And so it does look different. And so that shifts a lot of our kind of preparedness and collective recognition of what could be caused by a tick. However, this is certainly something that the whole point of this presentation is to launch our beginning campaign of awareness on really alpha-gal syndrome on Cape Cod. Because there are certainly folks experiencing these tick bites. When I was in Brewster over Labor Day weekend, I walked behind a gentleman who said, I had these miserable bites all over my ankles. I thought they were like chigger bites. He blamed chiggers. I didn't see an opening, but I was like, I bet those are Lone Star larvae. I bet they are.
Right.
Yeah, they're so
Yeah,
small.
I look back, although I haven't had any trouble with meat, so But I look back, I'm thinking back of the different itches and different little bites that I've gotten over because they love me. And I also had a friend who had a dog that got very, very sick for a year. We thought we were going to lose that dog, but the dog did rebound finally. But it was a long year and miserable to watch. What
I would
else do
also
you-
say that the Lone Star ticks are certainly a threat to pets as well. And so it's important to talk to your veterinarian about the best way to protect them against ticks. But the Lone Stars, they are aggressive and they will bite dogs as much as they will bite humans.
Does anybody have any questions?
No, I think Ron.
Rhonda.
Yeah,
Asked a
you know,
question.
if one gets bitten by a deer tick, you can send it off to the lab and they'll tell you whether that deer tick is infected with Lyme disease. But what you're telling me is that all the Lone Star ticks are capable of transmitting this allergy.
Yes, and you can still send in your Lone Star tick to figure out if it has infectious diseases. Like that might still be worthwhile for you. You might decide. But the alpha-gal syndrome part, no one's going to test for that because that's nascent to the tick. The tick has this molecule in their saliva at all stages. It's our bodies that decide this is foreign or not. Some people don't get alpha-gal syndrome from a Lone Star tick bite. Some people do. It's really your immune system deciding whether or not this is a foreign invader and creating an allergic response or not.
Yeah. You know, with Lyme disease, there seemed to have been an argument for many years among various entomologists as to the, you know, how it transmitted the disease. Some people say that it was exaggerated. Some people say it wasn't. In other words, how long the symptoms last. I have a nephew who, you know, he's 30, but he was diagnosed with Lyme disease when he was 18. And they say, well, is this a continuing of the Lyme disease? And, you know, it seems to me that it takes a while. It took a while for the scientists to get a handle on what the effects of this is and how long it takes. And I wonder what the status of the understanding of this particular disease is right now. I mean, do you feel you have a good handle on it and as to how its effects, you know, how many people it will affect and how long you know, I know you've given us good information, but do you really feel confident that you have a handle on this right now?
No, thank you for that question, Commissioner. Actually, it's still very much so an active area of science. There's a lot of questions still to be answered. And more resources from both the federal government and state governments are being directed to resolving those questions. For example, as I said, we don't really know who is actually going to become allergic. You could get a Lone Star tick bite. I could get a Lone Star tick bite. Who actually ends up developing alpha-gal syndrome and why is still a mechanistically poorly understood problem. There's a couple hypotheses, but there's not a clear picture to be able to predict who's going to become the allergic person. So that's very much so under investigation. Also being able to identify who's most likely to get over their alpha-gal syndrome. There's people who do not. And so there's people who have to live with this for the rest of their lives. And it is life-changing for people. There's definitely folks who do get over it, but we don't understand why. So there's a lot of still investigation to be done. I talk to one of the alpha-gal experts of the United States often. His name is Dr. Scott Cummins. He's out of University of North Carolina. And there's still much to be pursued. And I'm happy to keep the commissioners abreast of the information as I get it.
Do you think, I mean, it sounds like it might be a genetic predisposition to getting this allergy or, you know.
It is certainly possible. They're definitely looking at different components. That's going to take a great epidemiology study and a research study to really follow people over time. It's called a prospective cohort study to really figure out what at the molecular level is happening. And that's the kind of study that Scott Cummins works on. And so, yes, that still needs to be figured out.
So I do have one other final question. So say I have this syndrome and I eat a steak, I get sick. Is that how it works? Like you have an allergic reaction?
So for most folks, so again, the common denominator exposure, the most frequent reactive food is like mammalian meat. So when people with alpha-gal syndrome eat mammalian meat, usually 2 to 8 hours later, they have some sort of reaction. And Now, that can be also exacerbated by things like exercise and alcohol, things that make you vasodilate and make that food uptake into your system happen more quickly. And so there's different pieces of alpha-gal syndrome, and I do want to be respectful of time, but yes, there's variability in people's reactions, but the most common denominator is mammalian meat itself, and then it can also include dairy or trace exposures as well.
Yeah, just a quick question.
I gotta move on.
We're at the northern end of the range of this particular organism.
Yes.
Is it sensitive to climate? In other words, can we predict and saying, oh, we had a bad winter this winter, chances are there'll be fewer ticks or so on, or do we not have that information yet?
Escher, do you want to take that question? I can guess, but I'm not the entomologist.
Okay.
Let's see what you got.
Sure. I mean, I talk about it often and I work with another entomologist too, so I'm going to do my best here. So really, in terms of their hardiness in winter, I do think that has yet to be tested. We, for example, on Martha's Vineyard, we have winters very similar to Cape Cod. So if you're thinking about, is Cape Cod protected? I would not bet that you are, because Vineyard is seeing an explosion of Lone Star tick, and they've consistently seen an explosion of the population across the whole island, all 6 towns in suburbia as well as in rural for the last 15 years. So I would not necessarily count Cape Cod safe. Is Maine safe? Maybe.
Right, okay.
Yeah, we still have more research to do about the edge of the range and their hardiness to cold climates. But we do know that they are hardy to heat and dryness. So, like, just because you're doing regular maintenance of your lawn, it doesn't mean that Lone Star ticks aren't going to be on it.
Right. Well, this is a lot of information. I have been curious about this, not only because there are a lot of ticks around and we're usually in the woods, and you know, my friend with his dog, it was pretty scary. It was a great dog. And just get this word out to all those doctors' offices and clinics and libraries or wherever else. But whatever we have, we'll try to make sure we get out there. But it is something that people really have to be aware of. And now that if they get these symptoms, they might associate their visit to the doctor, you know, and be able to bring that forward. So,
Indeed.
Thank you, both of you, so much for this work. It is so important, and another great thing that government can do and help people with and help them navigate. So again, very nice to meet you. Welcome aboard.
Nice
and
to meet you.
Very good to meet you, Leah, and we look forward to seeing you again. And hopefully we'll be talking more positively with some sort of remedy.
Thank you for the time.
Thank
Thank you very much for your time.
Very much for your
Thanks,
appreciation.
Escher.